John here, and today we're putting you in the doctor's seat with 20 questions about the human body that even some medical students get wrong. Do you think you know your body well enough to be a senior health doctor? Let's find out just how much you really know. Score 16 or higher and you pass with flying colors. Score 20 and maybe you missed your calling. Ready? Here comes question 1. Let's start with something doctors check at every visit. What is considered a normal resting respiratory rate for a healthy adult? A. 6 to 10 breaths per minute. B. 12 to 20 breaths per minute. C. 25 to 35 breaths per minute. B is correct, 12 to 20 breaths per minute. Most people never think about their breathing rate, but doctors use it as a vital sign. Breathing faster than 20 times per minute at rest can indicate stress, infection, or heart and lung issues. Next time you're relaxed, count your breaths for a minute and see where you land. Question 2, and this one trips people up. Which blood type is known as the universal donor? A. Type A positive. B. Type AB negative. C. Type O negative. The answer is C. Type O negative. People with O negative blood can donate to anyone regardless of their blood type, which is why hospitals always need it for emergencies. Only about 7% of the population has this type. If that's you, consider donating because you could literally save any life. Now here's number 3. What is the normal pH level of human blood? A. Around 6.0, slightly acidic. B. Around 7.4, slightly alkaline. C. Around 8.5, strongly alkaline. B is correct, around 7.4, slightly alkaline. Your body works incredibly hard to keep blood pH in a very narrow range between 7.35 and 7.45. Even small deviations can cause serious problems. This is why those alkaline diet claims are mostly nonsense. Your body regulates pH regardless of what you eat. Here's what makes this remarkable. Your blood pH affects virtually every chemical reaction in your body, from metabolism to nerve function. Your lungs and kidneys work together constantly to maintain it, adjusting breathing rate and filtering acids through urine. When someone has severe diabetes or kidney failure, blood pH can shift dangerously, a condition doctors call acidosis or alkalosis. The fact that your body maintains 7.4 automatically without you ever thinking about it is one of the most impressive examples of self-regulation in human biology. Question 4. How many chambers does the human heart have? A. 2 chambers. B. 3 chambers. C. 4 chambers. C is correct, 4 chambers. You have 2 upper chambers called atria and 2 lower chambers called ventricles. The right side pumps blood to your lungs, the left side pumps it to the rest of your body. This dual pump system runs continuously from before birth until your final moment. Moving to question 5, what percentage of your blood is made up of plasma? A. About 25%. B. About 55%. C. About 80%. The answer is B. About 55%. Plasma is the yellowish liquid that carries your blood cells, nutrients, hormones, and waste products throughout your body. It's mostly water, which is another reason staying hydrated keeps your blood flowing smoothly and your organs functioning well. Here's question 6, and doctors ask this on exams. What is the largest artery in the human body? A. The carotid artery. B. The femoral artery. C. The aorta. C is correct, the aorta. This major blood vessel emerges directly from your heart and branches into smaller arteries that supply your entire body with oxygen-rich blood. It's about the diameter of a garden hose and handles enormous pressure with every heartbeat. Keeping your blood pressure controlled protects this vital highway. 6 questions done. How's your score looking? Keep count and let me know in the comments if you're passing or need to go back to medical school. Question 7. Which gland is often called the master gland because it controls other glands? A. The thyroid gland. B. The pituitary gland. C. The adrenal gland. B is correct, the pituitary gland. This pea-sized gland at the base of your brain sends hormonal signals that control your thyroid, adrenal glands, and reproductive organs. When it malfunctions, it can throw your entire hormonal system out of balance. Symptoms like unexplained fatigue, weight changes, or temperature sensitivity sometimes trace back here. Wasting. Question 8. Pay attention to this one. How many pairs of ribs does the human body have? A. 10 pairs. B. 12 pairs. C. 14 pairs. The answer is B. 12 pairs. That's 24 ribs total, forming a protective cage around your heart and lungs. The top 7 pairs attach directly to your sternum, the next 3 attach indirectly, and the bottom 2 pairs are called floating ribs because they don't attach at the front at all. Here comes number 9. This is a difficult one. What is the medical term for your voice box? A. The pharynx. B. The larynx. C. The trachea. B is correct, the larynx. This structure in your throat contains your vocal cords and allows you to speak, sing, and make sounds. It also protects your airway when you swallow, closing off to prevent food from entering your lungs. Understanding your larynx helps explain several common issues. When you lose your voice from a cold, your vocal cords are inflamed and can't vibrate properly. Acid reflux can damage the larynx over time, causing chronic hoarseness even without heartburn, a condition called silent reflux. For seniors, the muscles controlling vocal cord tension weaken gradually, which is why voices often become thinner or breathier with age. The good news is that speech therapy exercises can actually strengthen these muscles. If you experience sudden voice changes lasting more than 2 weeks, see a doctor promptly. Question 10. Halfway to your medical degree. What connects muscles to bones? A. Ligaments. B. Tendons. C. Cartilage. B is correct, tendons. Ligaments connect bones to other bones at joints, but tendons are the tough cords that attach your muscles to your skeleton, allowing movement. The Achilles tendon connecting your calf to your heel is the largest and strongest in your body. Keeping tendons healthy requires staying active but avoiding overuse. Number 11 now. Which part of the brain controls balance and coordination? A. The cerebrum. B. The cerebellum. C. The brain stem. The answer is B. The cerebellum. Located at the back of your head, this structure fine-tunes your movements and keeps you balanced. Damage here doesn't affect thinking but causes problems with coordination, walking, and precise movements. Activities like dancing, playing instruments, or even catching a ball rely heavily on your cerebellum. Question 12. How many bones are in the adult human body? A. 886 bones. B. 206 bones. C. 226 bones. B is correct, 206 bones. Interestingly, babies are born with around 270 bones, but many fuse together as you grow. Your hands and feet alone contain over half your total bones. Keeping them strong through weight-bearing exercise and adequate calcium becomes increasingly important after 50. Here's 13. What is the body's largest internal organ? A. The liver. B. The stomach. C. The lungs. A is correct, the liver. Weighing about 3 pounds, your liver performs over 500 functions including filtering toxins, producing bile, storing vitamins, and regulating blood sugar. Unlike most organs, it can regenerate when damaged, but chronic abuse from alcohol or poor diet eventually overwhelms its remarkable resilience. Question 14. Think carefully. Which type of blood vessel carries blood away from the heart? A. Veins. B. Arteries. C. Capillaries. B is correct. Arteries. Arteries carry oxygen-rich blood from your heart to your tissues, while veins return oxygen-depleted blood back to the heart. Capillaries are the tiny vessels where actual exchange of oxygen and nutrients occurs. An easy way to remember: arteries go away from the heart. Here's something fascinating about how these vessels differ. Arteries have thick muscular walls because they must withstand high pressure from heart contractions. You can feel this pressure as your pulse. Veins have thinner walls and contain one-way valves to prevent blood from flowing backward, especially important in your legs where blood must travel uphill against gravity. When these valves weaken, you get varicose veins. Capillaries are so narrow that red blood cells pass through single file, allowing maximum contact with surrounding tissues. Laid end to end, your capillaries would stretch about 60,000 miles, enough to circle the Earth twice. This incredible network ensures every cell in your body receives the oxygen and nutrients it needs. A. Aorta. Question 15. What is the smallest bone in the human body? A. The stapes in the ear. B. The smallest toe bone. C. A bone in the wrist. A is correct. The stapes in the ear. Also called the stirrup bone, it's only about 3 millimeters long, roughly the size of a grain of rice. Along with two other tiny bones, it transmits sound vibrations from your eardrum to your inner ear. Remarkable that something so small is essential for hearing. Moving on to 16. How much blood does the average adult body contain? A. About 3 pints. B. About 10 pints. C. About 18 pints. The answer is B. About 10 pints. That's roughly 1.2 to 1.5 gallons circulating through your body right now. Donating 1 pint is safe because your body replaces the fluid within 24 hours and the red blood cells within a few weeks. Knowing this makes blood donation seem much less daunting. Question 17. Which organ removes old red blood cells from circulation? A. The liver. B. The spleen. C. The appendix. B is correct. The spleen. This fist-sized organ filters your blood, removing old or damaged red blood cells and recycling their iron. It also stores white blood cells and platelets. You can live without a spleen if necessary, but you become more vulnerable to certain infections. Here's number 18. What is the average adult brain weight? A. About 1.5 pounds. B. About 3 pounds. C. About 5 pounds. B is correct. About 3 pounds. Despite this modest weight, your brain uses 20% of your body's energy and contains roughly 86 billion neurons. Brain weight alone doesn't determine intelligence. What matters more is the connections between those neurons, and those you can build at any age through learning and mental challenges. Almost there. Question 19. Which hormone regulates sleep cycles? A. Cortisol. B. Insulin. C. Melatonin. C is correct. Melatonin. Your pineal gland releases melatonin as darkness falls, signaling your body that it's time for sleep. Light exposure suppresses it, which is why screens before bed disrupt sleep. Melatonin production naturally decreases with age, one reason sleep patterns change after 60. Limiting evening light and maintaining consistent sleep times helps optimize whatever melatonin you still produce. Final question. Let's see if you earn that doctor title. What is the technical name for your kneecap? A. The tibia. B. The patella. C. The fibula. B is correct, the patella. This small triangular bone sits in front of your knee joint and protects it, while also improving the leverage of your thigh muscles when you straighten your leg. Knee health matters enormously for mobility as you age. Keeping your quadriceps strong takes pressure off this hard-working little bone.
And that's all 20 questions. So did you pass? Drop your score in the comments and let me know if you got what it takes. If you enjoyed this, hit subscribe and leave a like. Until next time.